member since 1972.
Since 1989.
ANA member since 1987.
Since 2003.
Since 1977.
ANA member since 1998.
Nurses can make a difference together. For more than 100 years, the American Nurses Association has been a unified voice for America's nurses. And today, ANA is the only full-service professional organization representing the interests of the nation's nearly 3 million registered nurses. Established to advance the nursing profession, ANA's contributions are found everywhere.
The American Nurses Association, you don't have to look for them. They are always out there working for you and on your behalf.
I really believe in the American Nurses Association. I feel very empowered, and I wonder why I didn't join earlier.
The American Nurses Association has made our workplace a safer environment.
It is essential that we unite under one voice and be heard as one group and make certain that our profession can have an impact politically.
Nurses can make a difference together, from state houses and hospitals to boardrooms and the White House. ANA's influence is essential in helping to write and pass legislation that stands up for America's RNs and the patients they serve.
There's only 3 nurses in Congress, so, we didn't have enough clout ourselves here. The American Nurses Association was critical. We couldn't have passed the Nurse Reinvestment Act that is affecting nurses' lives every day without the ANA.
Nurses should join the American Nurses Association because it's really their opportunity, their forum, their vehicle to make a difference.
Adequate and appropriate nurse staffing is critical to delivering quality patient care. And when the hospital Eric Williams works for tried to cut costs by replacing RNs with LPNs, ANA's evidence-based data came to the rescue.
Our data from the National Database of Nursing Quality Indicators demonstrated that our current delivery model, that being our RN to patient care ratios, had very positive effects on patient outcome.
Presented with the NDN-QI data, the hospital decided to maintain the adequate staffing of RN positions.
We felt at the end of the day that we had a victory for registered nurses and the patients that we serve.
Through the Safe Needles, Save Lives campaign, the American Nurses Association continues to lead the way on education of safe needle devices. From celebrating the signing of the Needle Stick Prevention Act in 2000 to today, ANA is keeping up the fight for the mandatory use of safer needles state by state.
I received an upper back injury while moving a patient who was anesthetized.
I have several injuries from lifting patients.
Both Kim and Sonia have had to miss work due to their injuries. Kim works in labor and delivery and says her heaviest patients can range from 200 to 500 pounds. However, manual patient handling is unsafe regardless of a patient's weight. To help nurses like Kim and Sonia, who alone can't make a difference, ANA created the Handle with Care campaign, aimed at preventing injuries through greater education and training, and using safe patient handling equipment like ceiling lifts, hover jacks, and power gurneys.
Look at that, one hand.
In 2006, ANA worked with the Washington State Nurses Association to help Washington become the second state to sign safe patient handling legislation into law. The new law gives nurses a defined role through required steering committees and offers tax incentives to hospitals to buy new lifting equipment.
Without the existence of the American Nurses Association, I don't think this legislation would have passed. The Handle with Care campaign was very important to the passage.
ANA's commitment to nursing revolves around ethics and standards.
ANA's given us our code of ethics.
Called the most important document to the profession of nursing, ANA created and interprets the Code of Ethics while setting the guidelines for the profession with Nursing, Scope and Standards of Practice. In a recent survey of ANA members, more than 90% cited ethics and standards as, quote, good reasons for belonging to ANA.
The American Nurses Association is just as relevant today as it was 110 years ago when it was formed. It was formed then to meet a need We needed to have an organization that would ensure that the profession was being advanced.
ANA is very deliberate in our initiatives to advance the cause of the profession. By belonging to the American Nurses Association, you're providing a stronger foundation to allow you to be a better nurse.
Nurses can make a difference together. Our future relies on you. Join us. With one unified voice, we can continue our progress and take on upcoming challenges stronger, better, together.
I plan on joining the ANA. Membership benefits and being able to have my voice heard.
And it definitely is something that I would like to join when I become a registered nurse.
American Nurses Association is that place where we all come together.
It's for us. It's our voice. It's your opportunity to speak. Don't stand by and let someone else make decisions for you.
I love being a nurse. I love making a difference. The American Nurses Association is a way to get legislation passed. So every day, every shift, every patient, the healthcare is excellent, safe, and efficient.